Welcome to Emotional Autoimmunity. This is my first interview of the year, and I'm absolutely thrilled to be talking to Joe Busuttil. And Joe and I go back a bit, actually. Joe was originally one of the people who taught me hypnotherapy, so it's really exciting to be connecting with Joe again today and giving you all the opportunity to meet him and hear his story. Joe is a state government approved counsellor. He's a clinical hypnotherapist and a life coach operating out of Melbourne. So welcome, Joe. So lovely to see you today.
Hi, Kerry. How are you? Thanks for asking me to come and join me today.
It's fantastic. I was so excited when you agreed to do this. It's I think you've got a really interesting story to tell that's going to help a lot of people.
Okay.
So the first question, Joe, is what is the illness that you have? And if you could tell us a bit about your journey to actually from there to where you are now.
Yep. So I've been diagnosed with a condition called vasculitis, and vasculitis is an inflammation of the nerve system and also some of the veins or arteries in the muscles. And for some reason, I'm seeing this complex through the medical system because I only seem to have it on the left side of my body. So the right side of my body is fine, but the left side of the body is heavy. The muscles are weakened, and if I don't treat it properly, they sort of fade away. And so it impacts my mobility, walking, showering, all those sort of things. I've had it probably since December 2015, and it started in my left eye, and I stupidly didn't really think it was anything serious. I did go to the doctors, but they found nothing in their tests, so I soldiered on and kept going. And then in January, I got it in my left arm. And again, being naughty as I am, I actually ignored it totally. I didn't go to the doctors. I just thought that I slept funny. And then around March of 2015, I was in Singapore, and then it affected my leg, and I started to fall over, and that's when it got taken seriously, and I went to the hospital and got diagnosed there.
And a lot of people, Joe, can sort of look back and see that their disease had been brewing for a long time, maybe years. So as you look back over your life, does giving a diagnosis give you any new insights into anything you struggled with when you were younger, or any time that you felt different from other people, or has this been more of a sudden onset thing?
Well, look, this has been a bit of a journey because I've been sick for over 12 months. And as you and I know each other, I'm very similar to you. I've never been sick before. So it was a little bit of a shock to go from being a really healthy, eat well, gym-bodied person to then all of a sudden not being able to move and to, lose 10 kilos. And, the main thing for me was just, I'm a go-getter. So not being able to do the things day to day that I would normally do was really hard for me. I now understand that this condition for me has been brought on by tiredness and stress. And so looking back, I was working sometimes 14 days straight. Sometimes I was working 10, 12-hour days. And, I tricked myself because I totally love my job, but I didn't realize that in the process of loving my job, I was abusing my body. And so the signs were slowly being told to me, slow down, have a rest. But I just thought, no, because I love my job. So then my body retaliated. So there's that aspect of it. I think the big blessing for me there is to, have balance in my life and slow down. Also, vasculitis comes from the tree of arthritis. And I've got a few people in my family, including my brother, who have got rheumatoid arthritis. So in some way, some of the signs or symptoms of rheumatoid arthritis are connected to vasculitis. So I'm guessing there's a bit of a hereditary thing there. And just recently I've discovered through doing some healing work is that I really do believe that there's a connection with my masculine and my feminine energy. And that could be linked to why it's the left side of my body. There may have been a disconnect from, my feminine energy at certain times. And so now it's sort of playing up. It's being an awareness. So I don't really know much about that side of it yet because I've only just learned about it. But going back to your question, looking back at my past, I could see how some of my masculine experiences, some of my masculine energy wasn't really forward. I was more connected, maybe more to a feminine energy. And as time's gone on, I think there's been a counterbalance with that, which may affect, you know, my balance or my chi in a way. If that makes sense. So that's something I'm exploring more now. I'm exploring more about creating harmony between the masculine and the feminine, the left and the right, you know, the spheres of the brain, to try and find that harmony with my body and learn to live with what my body can do now in a much more productive way.
It's sort of making the most of it, what you can do now, isn't it?
Yeah, well, I mean, like, part of it's surrendering, because that was a big part of this whole journey. Was I was attaching a lot to that ego part of it, like, why me? And, you know, there was that victim mentality, like, you know, I don't like what's going on. Even though I was trying to be positive at a mask level, you know, at a deeper level, I really sort of kept hoping or thinking, I'm going to get better tomorrow. It's going to get better tomorrow. And each day it didn't get better. So eventually I had to surrender. And it's funny, Kerry, that once I surrendered, that's when I sort of noticed I started to get better. You know, the attachment, I think, kept feeding some of the stress. And so that sort of kept me in that stuck sort of state of not seeing any signs of improvement or recovery. Yeah.
I think, I can really relate to that, Joe. I know I went through that. I think it's like you're fighting against it. You want it to be different. You know, you're scared of what's happening to you. You don't know what's going on. You just want to get back to how you used to be. And I think I reached that point too, of just thinking, this is the way it is.
Yeah. It took me a few months to get to that point. And funnily enough, I came across a online course called Engaging in the Flow. And for some reason, I don't normally pay for courses online because there's so many, but like for some reason, it's something that the guy that was running it said connected me to it. So I, enrolled, and I would listen to it every Monday. And funnily enough, the whole course was about surrendering. And so it was like the guy was talking directly to me at a time that I needed to hear those particular modalities and ideas, like, surrendering to a concept, allowing yourself to be in the moment, knowing that you're not what you think you are. All those sort of things were sort of coming to me really fast. And I feel blessed that I came across that, because it helped me immensely to sort of surrender and start saying out loud to myself that I'm not well, rather than thinking, this is not really happening, or this is something that I'm going to get through quickly. Because nerve damage takes a long time to heal from. It takes years. And I know now that I probably was not impatient. And so I'm learning now to be patient, because you've got to trust that the body's doing what it needs to do. And when I have really sort of heavy days, it's really my body's way of saying, Joe, you need a rest. Well, I think in the past, I just kept going, and I ignored those signs. And it's interesting how you think you're healthy and young, because I've considered myself both those things, but in one quick second, like, it wasn't that long, it's just everything gets taken away, and your whole life is sort of then put in a different sort of dimension or different path. Yeah, so it's been good. It's been interesting but good at the same time.
Yes, it can be a very sort of defining line, can't it? It's almost like you can see yourself tipping over from healthy and normal to chronically ill, and who knows what's going to happen now.
Yeah, but funnily enough, is that going to the hospital, I have to get like blood transfusions every 2 weeks or 3 weeks. And so been doing that for a whole year, so that's a lot of visits to the hospital. And going to the hospital and meeting other people who are getting transfusions has been really good, because you sort of realise that your condition isn't as bad as, say, what other people are going through. So it's made me a little bit humble. Like, even though there have been times when I've been in a wheelchair, or I haven't been able to shower or go to the bathroom on my own, I can now. But I've met people that have got MS, or met people with neuromotor disease, or people with other conditions who, they can't do, they're never going to be able to do those things, but yet they're positive and their attitude is really uplifting. So it's been a blessing to come across those people, because it sort of wakes you up a bit, going, you don't need to be the victim here, Joe. You could be empowered. You could still work from a wheelchair. You can still do things, you know, without being able to walk. Yes, some things are lost, but there's other things that you can sort of substitute with, which has been, that's been the best part of this journey for me, is actually adapting and making things work in a positive way.
Absolutely. And it's, I think, you know, looking back over the worst of, or the height of my illness, there were some really amazing and beautiful things that happened in that time, whether, like you said, it was the right course or the right person or the right words or the right thing that came to help me. And in many ways, I think it's enriched my life.
Yeah. Well, I mean, if you look at it really, like, if when you're sick, you're sick, aren't you? And so you either, I'm a strong believer is that you either have a yes or a no philosophy. So if you embrace the yes, then that means that you're going to be open to the enrichment or the experience. But many people, and I'm not going to say I haven't, because there have been times when I've said no. There have been times when I've, you know, had really bad days and been a sook in bed and not wanting to face the world. But, you know, hopefully you're able to sort of assess and go, okay, well, this is it. Do I spend my life or this moment here, or do I actually choose to sort of be open to the opportunities or the coincidences or the people or the events that may teach me or guide me? I don't know about you, but I sort of feel lucky that I was a therapist before I got sick, because I've done some work already. I would hate to think maybe what would have happened if I didn't know or have awareness to the level that I did. Like, you know, that's been something I've thought about for a while. Like, what would have happened if I had no idea about awareness or observation, or if I just kept stuck in victim? And as a therapist, it's been really, really beneficial to understand maybe what some clients may, you know, present with in regards to trauma and in regards to how they perceive it for their own lives.
Oh, absolutely. I was really blessed that I had the skills that I did. I mean, when we were talking before we started the broadcast, and I was saying to you that really the thing that I think saved my life was my ability to be able to research and to focus and to find information that I needed, and to actually be able to put that all together in the way that I work with clients. I had that integrated, being able to see the big picture and the things that happen to you. So I could even observe myself, like going through the phases of grief, for example, when you talk about accepting the illness and going from being healthy and mobile to suddenly being, you know, very unhealthy and very dependent and with no idea of what's going to happen to you. And so after I did the whole fall apart, which I think is necessary and healthy, I did have those skills to be able to actually analyze myself and go, okay, let's start using the tools and let's start using the insight and work with that. And yeah, I think that really, really helped me.
Yeah. Yeah, it's interesting because just listening to you, like you know, when I think about getting sick, I would have thought that would have been more healthy for me to be a bit depressed and to grieve at the beginning. But I was quite positive and quite, you know, optimistic at the beginning. And then it didn't really hit me till halfway through the illness that I went into that really heavy, oh my God, what's going on feeling. I thought I had enough energy or enough insight to sort of get through it, but I noticed that I wasn't getting better as fast as I wanted to. I also noticed that the doctors were sort of saying, I guess in a positive way, you know, it just takes time, you'll get better, it just takes time. And so I really held on to that, and I wasn't getting better. Yeah. And so then later on, then they sort of confirmed that I was complex, and there was only about 80 other people in the whole world that have got what I've got, the version of vasculitis that I've got. Yeah. So that sort of became a little bit uncomfortable for me to go, oh. And then, you know, when you hear doctors saying things like, we don't know what to do with you, like, you know, we haven't seen this before, you know, you should be getting better by now, or like, you know, things are getting worse and we don't understand why. I sort of, like, I think went into a bit of a panic then, and that's when it really sort of hit me like a tsunami, and I had my little meltdown. I call it my meltdown in July. You know, I envisioned in my head snow melting. So it was good that I went through that, because that was the portal to me then stepping into the next level of vibration, I believe.
Yeah.
I think that if I sort of was in denial a little bit, thinking, yeah, I can cope with this is all fine, without going through that meltdown, I wouldn't have transformed as much as I have now, because I do believe that I'm in the midst of a major transformation. I still don't know where this transformation is going to take me, but I'm definitely in it.
For sure. And that's, yeah, I felt very much like I was going through the caterpillar phase, you know, and I was in the cocoon and I didn't know what was going to happen to me when I came out the other side and what the other side was even going to be. And I think what I really came to see clearly, because I've always been of the opinion that we're responsible really to create the life the way that we want it to be. And when I got sick and I realized that there was no answer, no real help for me in the medical system, not the way, you know, the medication they had me on didn't work for me. It just made me worse. So I really had to go out there and find my own way. And so I think there's that point when you become chronically ill, because up until then, my experience had been you get sick, you get better.
Yeah.
You get sick, you get better. Or you get sick, you go to the doctor, they give you something, you get better. And when you have something,
you just don't get sick at all, because like,
yeah, or you don't get sick.
Yeah, I mean, look, I've only just, my common thing is just having maybe a 2-day cold, but you know, being sick for more than 2 days is you know, daunting for most people.
Yeah, exactly. And then you sort of realize that, okay, I can either continue to keep going out there, handing over responsibility for me and putting in the hands of other people saying, make me well, give me something, do something for me, or I can say, okay, this is what I have. What can I do to help myself? Like, what actions can I actually take to help myself? And then that was, okay, I need to find someone who can work with me. Like, I need to actually go and interview doctors. I need to stop being passive. I need to be active and say, this is what I want. This is what I need. I have a plan for myself and I'm taking responsibility for my health. And so that, and I think being so sick gave me that determination, because it literally was, I was fighting for my life. And so it was that shift to, okay, I've got to have this the way that I need to have it. I'm the most important thing at the moment, because if I don't do what I need to do, then nothing's happening. You know, my family doesn't go on, my business doesn't go on, my life doesn't go on.
Yeah. Yeah, it's funny because my situation was more born out of anger. You know, I was really quite happy to go along with the plan that the doctors had for me. And I believed that, you know, I was on track. I really did, like, they didn't promise me an exact date, but I thought by December 2015, I would have been better. And I booked a trip to America to go to a hypnotherapy conference. And so I was like ready to go. And so, but I didn't get better. And so then I started to realize that I got angry and I had to sort of become verbal with the doctors and I had to make them accountable. And that was then my shift to sort of then start doing the things that you're talking about. Like, until then, I think that I probably was a little bit complacent, thinking that even though I was doing things that were right, that I just thought I was just going to get better and things were going to go back to normal. And they're not. You know, and that's the thing. They're not. I probably won't go to a place of pre-2015 again. You know, now it's about learning how to adapt. Also, I found it really difficult because every time that I was tired, because my vasculitis comes with exhaustion, and I was sleeping a lot, and I'd raise it with the doctors would just try and diagnose me with depression or other conditions, and I knew that wasn't the case. I knew it was the medication, and they just didn't believe me. And so they sort of just explain it like, you know, you have a lock and you have a key, and when you put the medication into that key, it fixes it. But for some reason, my medication just didn't work, and it was doing the opposite of what it was meant to do. And that went on for a year. You know, it took a year for them to believe me after getting angry and actually making them accountable. Like, guys, this isn't working. So that's when the door opened for me to start exploring holistic approaches and, you know, trying herbal medicines and all those different things. And I've got a really, you know, I'm developing a really good team at the moment to get through that now.
And that's absolutely true. You've got to have your health team, and you've got to, you know, do it your way, because we're all individuals. And even though with autoimmune disease, there's, you know, a cluster of symptoms like exhaustion and, you know, those different things that are the same, individually we're different. And so we respond in different ways, and you've got to very much, you know, find the way that works for you. And Joe, one of the issues with having a chronic autoimmune disease is we look healthy, but you've got this invisible illness that people can't see and they don't understand. So what do you need to deal with now that you didn't before? And how have you had to adapt your life?
Well, I mean, I'm still probably in the phase where I don't look healthy. Like, I still have, I had to learn how to walk again. And so I started walking again probably in July. And so I sort of call myself a bit of a wobbler now. Like, people joke around and say, like, you've got a cute wobble. So I'm learning how to strengthen my left leg. So there's that. Also, there's a bit of a psycho thing going on where I do have this phobia where I think I'm going to fall. Because back in March, I was falling all the time and it was terrible. And so when I go out into the world on my own, I'm really cautious about, flat surfaces. I still can't climb stairs. I've got a walking stick. So people can still see that something's wrong. Also, I've lost a lot of weight muscular-wise. So that's still, a lot of people are sort of taken aback. Like you even said when we started talking this morning that, you've lost a bit of weight on your face. So I know that still is a visible sign that I'm not well. So I guess I've had to deal with that. It's my ego again. I've had to deal with the ego, dealing with the comments. I've realized that I didn't think I cared about what people thought, but I realized that I did. And so I found that in the very, very early stages, probably 3/4 of the illness, I've been really avoiding a lot of contact with people I don't know very well because I was uncomfortable about the way I looked or about the way I walked. So that was really strange. And then funnily enough, I was comfortable to teach in a wheelchair. So I sort of tried to think back, why am I comfortable with students and clients, but yet I'm not comfortable with my friends? And is this more a personal thing where my ego, they know me, or is this where I just didn't want to be told the truth because they knew me and they could speak? So all that sort of stuff came up for me. So that was really, really interesting. The other thing was just, again, being able to verbalize to people around me that I'm slower now and I've got to do less. And, I can't go out for dinners and I can't do things where there's stairs and I can't be out for a long time. I've got to be in bed by 9 o'clock. So all those sort of things took some time because a lot of people didn't get it. Or they didn't really understand what vasculitis was, or they didn't understand what I had, or if they didn't understand why my situation was rare and complex. And so communication was really important. In the process, I feel like I've probably lost a few friends not because I don't care, but I think because they didn't know how to cope, or they didn't know how to deal with sick Joe versus healthy Joe. And so for them, their way of dealing with it was to probably avoid me or not to make contact, because that would be in their mind maybe the easiest way of thinking that was good for me, but it wasn't. I probably needed support the most in the earlier stages, but the good thing is that people that I didn't expect to step up stepped up. So it opened up a new pathway for new friends and me connecting with my family in a better way. So those sort of things were things I had to deal with in the face of all that, yeah.
And I think that's true. When you're brought to that place where you need to become incredibly vulnerable and ask for help that you've never had to ask for before, it really does transform your relationships. And, some will fall away because they just can't handle that. And others become, richer and deeper, and you see a side of people that you didn't really expect. That's absolutely wonderful. So
I saw people I saw people came to see me and people contacted me that I didn't think were close. Like random people. Like I used to work in a bar, for example, when I was studying, and people that I'd serve at the bar that, they're just customers. They would come to the hospital, where I had really close friends, not come. And, maybe part of that was me not allowing myself to open up to them to come, because maybe part of it was me being afraid as well. But I think that whole flight or fight where people can't cope or can cope, where people step up or people back away, is quite an interesting thing, not just with illness, but with many things. Like, I always wonder, like, why is it that when people separate in a relationship, sometimes people run away? Or why is it when someone has anxiety, friends may, you know, not contact them? And it really does boil down to the fact that some people just don't have the tools. And when you understand that, when I surrendered to that, that's what freed me. You know, I was angry for some time. You know, I was a little bit, and then I thought anger is not going to help my condition. You know, anger is not going to heal me. I sort of have to find a nice place where I can be calm and understand that I can't control what other people do. I can only control what I do and how I live my life.
It's that cycle, isn't it, of accepting and then moving, accepting and then moving, accepting and then moving.
Yeah, yeah. I mean, there are days where I just say to myself, God, I wish this would just end. You know, like those days where you just want to, you know, especially in summer. I find summer's being really hard. Like it was okay during winter. I could get into bed and watch television with the doona and just love it. But in summer, I sort of feel like a prisoner. There's this like part of me that goes, like I really want to go for a run today, but I can't, you know. So I really like to go for a walk on the beach. Those are the days that you're challenged, isn't it?
It is. And you're talking about, you know, hospitals before. Has your view of hospitals and things changed? Like looking back when you first started your journey with your vasculitis to now, what would you, if anything, do differently when you're dealing with the medical profession?
Yeah. Just by chance, my uncle had a heart attack previously before I got sick, and because of that, I increased my health insurance to the top cover. And of course, I didn't realise that there was a 12-month waiting period then for me to claim, and I got sick 2 months later. So the first thing was I really should have been a private patient, but I had to experience the public system, which was a little bit, at the beginning it was a little bit overwhelming because I was, you know, hoping for a private room and I was hoping for privacy, and I was thrown into a neurology ward with people that have had strokes and people that have had dementia and people that have had, you know, conditions like myself, MS and all that, and it was scary. I remember the first night in hospital, I cried because there was this woman with dementia in my room, and she was like screaming at 3 o'clock in the morning, and there was a team of people, and I'm thinking, what is, you know, the sheets up going, what's going on? But that sort of changed really quickly. Like I feel like I got really adapted to the system, and I had a really good team of doctors, and they were really attentive and they were really, you know, supportive and so on. So I think that during the initial crisis part of it, I really loved the system. Like the nurses, everyone was really good. But as an outpatient, that's probably where I probably struggled a bit. Like I found that some of the doctors didn't talk to each other. They were from different departments, and that really frustrated me. Like the waiting, I found that if I didn't ask assertively, certain things may not get done. You know, and they knew that I was sort of like an intelligent patient. Like they kept saying to me, oh, you're really intelligent. You know what you're talking about. And I thought to myself, what is everyone else like? So it made me also aware that other patients just take it, where I was asking a million questions and I think I annoyed them a little bit, you know, but they got used to me. But it was more, it's about more getting things done. Like the medication thing, my sort of like allergy to my medication could have been fixed in August. So I really could have had 5 months of being a lot healthier. So it's those sort of things. So I've learned that you've got to be assertive. I've learned that you've got to tell the truth, and, you know, you've got to realize that you're a product in a hospital, which is really a business. And so I'm their client. And the funny thing is, a nurse taught me that. She goes, you know, it's about being seen as that. You have to speak up because you are the product. And so I didn't have to agree to everything that they said, and that really helped. I didn't have to, you know, accept their decision. I could ask for a second opinion, or I could ask for a test, or I could ask for them to do more research. And I found that once I started doing that, they stepped up.
And that's such a great point, Joe, because, you know, we seem to have this really altruistic view of doctors and hospitals and medicine as if it's, you know, they're just, you know, out of the goodness of their hearts to save us. And while that might be the reason that people go into medicine and practicing, it's a business. You know, that's how they make their money. It's a massive multi-million-dollar business with the tests and the structures and all of that. It's a business as an organization. We are the clients, and we really do need to change that view of ourselves as seeking a service provider. The same as you would, go to a massage therapist, or you wouldn't go to a dentist who wasn't any good, or you wouldn't see a counsellor who wasn't any good. You are the client. You look for the person who is going to partner with you. And it's not the old view of, the doctors are God and they tell you what to do and they have all the knowledge.
Well, I think that's still, I agree with what you're saying, but I still think that the philosophy is still there, where they do believe that. And then I think that most, patients believe that. Most patients don't believe in options. And again, I've been trying to understand where my assertion came from. And I'm thinking, well, maybe it's again connected to what I know from being a therapist. Also, I think that, everything's got a reason. So that's the reason why I went into the public system, I think, because being in a room with three other patients and, saying that, I was the youngest person there to a lot of older people, but they got sort of like treated sort of, not badly, but they were dismissed a lot of the times. And observing that is what made me realize that you don't need to, you could speak up, you could ask to be treated differently. And I'm not saying that the nurses or the doctors were bad. They were fantastic. All I'm saying is that you don't need to believe everything they said. Like they wanted to do, for example, I had a muscle biopsy, which was very painful. And then they wanted to do a nerve biopsy, which is done on my toes. And so what they do is they remove nerves out of your toes. So that means that one of my toes would stop feeling. And so when I, asked questions about it, the outcome of finding something out from that biopsy was only 3%. There's only a 3% outcome. So I sort of decided no. I said no. And even though they were trying to convince me that, we may find something, I said, no, find some other way to find something for me. I don't need to go through that trauma for something that is only going to be a 3% probability of finding any information. So it's those sort of things that I think that are important, and people don't really get taught how to deal with things in the hospital. Or, you get told a diagnosis and we believe it. You know what I mean? It's like when I first got diagnosed, they sort of started putting ideas in my head that I might have cancer. And I'm thinking to myself, why would they do that? Why would they say something where we haven't tested for it yet or there's no signs of it? Wouldn't it be better to say, let's test to see if there's anything else? So in some way, it's, it's the way that they communicate, it's the way that they behave, because they do believe that they're a sort of demigod, because that's how hospitals have been run for a long time. So I think if we want things to change, we just need to trust that we can communicate and be assertive and not worry about being banished or told to leave or anything like that. I mean, I found in my experience that once I got assertive, the doctors sort of like woke up. They were doing things much more quicker, more effective, rather than me waiting months for results or answers.
Yeah,
Can you hear me?
Yeah, it's stopped for a little while.
Yeah,
and that's that's such a really good point. If you hadn't have asserted yourself, you would have had that nerve damage in your toe for the rest of your life, through 3% probability of finding anything useful.
Yeah,
and it was only your knowledge and your insight and your ability just to say no, find another way.
Yeah,
find another way. And
that's another difficult part, Kerry, is that when you haven't been sick before, and then on top of that, getting sick and being told that you're complex or this is a rare situation, you do sort of feel like a guinea pig, because there doesn't seem to be a precedent where, okay, this steroid's going to help or this blood transfusion is going to do this. What they're really doing is they're just saying, let's just try and do things and hopefully one of them will work. So in other scenarios when people get sick, there's normally a precedent where, okay, I've got cancer, let's do chemo. The likelihood that you're going to get better is, this, or, you've got this flu, let's take this tablet. So that's been difficult as well, where my patience level has fluctuated where, okay, let's go with this treatment. and then you get side effects and you feel terrible and you're sort of thinking, oh my God, I don't think I can do this, and trying to get them to take you off that treatment is difficult. So it's hard being also something that's a rare condition or something that hasn't really been studied or they've seen a lot of at this point in time, which surprised me a little bit, because in my, you know, silly head, I thought the doctors knew everything. And they don't.
No.
Yeah.
No.
Especially with immune conditions, don't they? Immunity, stuff with immunity is still quite a new finding. They're still doing a lot of research. It's a lot of stuff that, you know, there's no answers. Like when we look at MS and neuromotor disease, there's no cure for those. You know, so when you're going through an illness that's related to those things, you're sort of thinking, please God, don't make it be MS or neuromotor disease. And then when it's not, you just sigh relief, you know. So it's interesting what people must go through, the different phases and stages of learning and experiencing their illness.
Absolutely. And a lot of us, you know, there's so many challenges to the way that we relate to our body, because you go from being used to your body operating one way and then suddenly, you know, it's different, or it looks different, or it's not operating the way that it did. And a lot of people with chronic illness often say that they feel that their bodies have betrayed them. So did having your vasculitis, has that changed the way you see your body and your relationship with it?
Yeah, big time, yes. Again, I'll talk about the ego part first. I used to love going to the gym, and I used to have a six-pack, and I used to have, you know, decent arms and chest, and I liked that. As a 47-year-old man, I liked that I looked good. When I got vasculitis, it was very quick. I went from that to being, I looked in the mirror and I felt like I was 100. You know, I had so imagine vasculitis is the sort of like the part of the body that would talk from the brain to the muscles. So my brain would say, pump blood into the muscles, walk, lift this thing up. So vasculitis inflamed the muscles and the nerves, and so that message couldn't get through. And so very quickly, the muscles in my leg, in my arm, in my shoulder, in my back, in my chest died. So it went from being pumped to being flat. So I had, like, you know, floppy arms, and I had wrinkles in my armpits, and I looked in, and I remember my legs looked really thin, and I looked in the mirror one day and I just broke out crying, going, oh my God, I'm 100 years old. So that sort of was really hard to deal with, because I then felt, I went through a bit of shame there. I went through a bit of, like, you know, not liking what I was seeing. And I sort of then started to talk about, oh my God, I'm never going to have sex again. I'm never going to be in a relationship again. No one's going to, all that sort of ego sabotaging self-talk was so loud. Thankfully, I then did the course I did, and I started to love and accept my body. So that was really good. From a physical perspective, I found it really hard not doing the things that I loved, like running and, you know, moving fast, and, you know, dancing, and, you know, hiking, and just going to the city and just going for a walk. I could only walk for, you know, maybe 5 or 10 minutes. So that was really, really hard, going from being an active person to being in a bed, or having to be pushed around in a wheelchair, or not being able to have a shower or cook my own meal, or, you know, at the beginning I couldn't even get out of a chair myself. So that was, you know, looking back, that was so annoying. I really hated it. But then again, I surrendered to it and just allowed myself to rest, and just started watching heaps and heaps of TV and caught up on all those TV shows that I've never watched and heard a lot about.
Thank God for Netflix.
Thank God for Netflix. You know, Game of Thrones and all those shows that I never really watched, I, you know, devoured in like 2 days, 3 days. So, yeah, that was it for me. It was the ego versus the mobility part of it. It was a shock, you know, because especially the body part of it. It was, you know, now I can look back and I've learned and I understand at a deeper level that, you know, the body's just a vessel, and what's in my heart and my brain is what's important. But at the beginning, I didn't really, you know, I think it's normal to go through a bit of a shock part of it. You know, the masculine part of me again was really, really confronted, you know, feeling ugly, you know, looking old. All those sort of things hit me at once. It wasn't just one dilemma, it was everything, like aging and, you know, I feeling that I was a dried up old man and, like, you know, all that sort of stuff was present.
Mm. And because it's so sudden, I think, you know, that's another hallmark of autoimmune disease. I can remember, you know, I started gaining this massive amount of weight and I had all this swelling in my face and my hair started falling out. And I looked in the mirror one day and I didn't recognize myself.
Mm.
And it's just the most confronting feeling to look in the mirror and say, who is that old, sick looking person?
Yeah.
Because
Yeah.
it seems so sudden.
Yeah. Well, it's funny because, you know, you're sort of getting sick with yourself, but, you know, the mirror is, you know, I avoided the mirror a lot. But then when I saw it, the other thing is that people are mirrors. Like, you know, you could tell, I don't know if you experienced it, but you could see in other people's faces.
Oh, yeah.
You've got those gorgeous friends that will just tell you straight away, oh my God, you've lost weight. And you sort of say, thank you. And then you've got those people that don't say anything, but their eyes or body language tells you that they're uncomfortable or that they can see something, like they look away. And I don't know which one's worse, because it's like you sort of want to speak about it, but I wasn't ready to speak about it then. So I found myself running away or avoiding, you know, having confrontation like that.
When you see the shock on somebody's face when they see you, that's really confronting.
Yeah, and I think in hospital when I was at my worst, or when it all happened, it must have been shocking for some people, because on top of that, you've got you don't sleep in hospital, you know, the food isn't the best, so you're sort of losing weight quicker in there because you're not sort of getting the rest, you know, even though you're in hospital, you're not really getting what you need. And so I think that was when a lot of people were going, oh my God, you're really sick, like something's wrong here. And yeah, that's confronting, because I was, at that point, I was trying to avoid admitting to myself that I was sick. I was trying to be positive at the beginning, and I didn't want to be around negative energy. And but you know, people can't help it. I guess it's what they're seeing and what they're experiencing with what their, you know, their friend or their brother or their son is changed.
And it's frightening for people to see you like that, because, you know, they realize that they might lose you.
Yeah, and I don't know what, really, they didn't know what to do or say in that situation. You know, like, you know, I don't know if you experienced, a lot of people say, I'm here for you, right? But really, this is something that they say because when it boils down to it, they didn't know what to do. And it's understandable, because most times people are healthy, and when someone gets sick, you don't really know what to do or say. You know, you don't know what to give them. And for me, all I really wanted was just someone to be there. They didn't do anything. You know, there was the isolation that came with that during that time was probably a good thing, because I could get through the body changes myself, but it was also a bit of a mental health negative thing where you're sort of thinking, I've been abandoned, you know, no one's sort of around. But again, I think that's part of the whole grieving, isn't it? Where you go through those stages of what goes on in the process of being ill.
And there are all those thoughts that go through your mind, like, you know, will I ever have a relationship? You know, who's going to want to date somebody with a chronic illness? You know, what's going to happen to me? Am I still attractive? All of those different things go through your mind, don't they?
Yeah, that was big for me. I mean, I'm a gay man, and so you know, that's up the ante now, where, you know, a lot of attraction when it comes to gay life is physical. You know, it's very physically, you know, you're physically attracted to someone before you get to know their mind. And so that was a really big thing that that impacted me in my head, where, you know, no one's going to get to, you know, people are going to be really unattracted to this. He's going to want to be around, you know, this. And because it was with me for a long time, you know, that really played with my head a lot. And, you know, I sort of started to then disconnect from, you know, my gay life, or disconnect from even thinking about anything like that, which, you know, now I'm not. I'm now, you know, more engaged and connected because I know myself a bit better. But during that initial first few months, it was daunting to think, where does one go where does a disabled gay man go to meet someone? So it was funny. And the answer is, well, you try and pick up doctors.
Oh, I love that.
You sort of try and find some humour in it. Which, of course, I got myself into trouble.
So we know that, stress is a huge thing for any sort of chronic illness. It's not enough just to get the right medication or to have the right diet. Things that are going on in your life, and stress can really majorly set off a flare and make you feel worse. So what have you had to sort of change about your life, Joe? Because I know you're very aware of, stress and mindset and all of that. So has there been anything you've specifically consciously changed to reduce your stress?
Yeah, I meditate 4 times a day, and I start at 5 a.m. and I would that's my foundation. Like, I know that by doing those 4 sessions a day, they're not long, only half an hour each, but they really maintain a level of sort of equilibrium. I've also discovered sound therapy, which I really love. And all that sound therapy is just hearing a vibration, like a theta vibration, that's that you vibrate through your whole body, and you listen to it for about 5 minutes. And I've got a series of vibrations that make half an hour that are all connected to the nerve system. So I don't know why, but my system loves it. And so I sort of find myself that whenever I've got a spare 10 minutes, half an hour, I just listen to them. So I do that quite a lot. I've done the same thing with my diet. I'm, changed the way I eat. I sleep a lot more effectively. I go to bed early. I've sort of cut back the amount of hours that I work. I work sort of part-time now. The main thing, though, I feel that I've done is that, and I'm not saying this in a negative way, but being a therapist, I think that I attracted a lot of friends with problems. And I love my friends. God love them, but in the old me would have been very open to listening to their problems and chatting over a cup of coffee. The new me now has to be really diligent to not allow myself to get caught up in other people's stuff, because I'm doing it at work and I can't afford to then do it at home. And to just, so I'm really conscious about really maintaining my energy and focusing on me, and again, I think the old me thought he was doing that, but the old me was actually probably secretly enjoying helping others, secretly enjoying being around people and just doing whatever comes up. But like the new me that can't do that, or the me right now can't do that. I need to be really, really diligent and really strict when it comes to, people unconsciously dumping their stuff on me, or people wanting stuff from me that I physically can't give. So I've been able to be more verbal, and I'd say to some people, look, I love you, but I can't talk about this right now. I can't really hear this right now. I really can't be here for you right now. Yeah. I need to sort of focus my energy on me. Now, that was a really big challenge for me, but it's been freaking amazing, because it's really transformed the way that I communicate and the way that I love myself and respect myself, which I think, going back to one of the questions you asked earlier, that's probably one of the main threads of why I'm sick, is because I may have, spent so much time caring about other people than myself in elements or times throughout my life. And this is about me now.
And you've got to reach that place, don't you? Because you've got to get over that shit about being selfish. You really do. It's about having good boundaries, and it's about understanding that you, as the person living in your body, needing to get on with your life, when you have to say no, then you have to say no, and that's the way it is. Because if you're not looking after you, everything else in your life is going to suffer. Yeah.
And it's hard because, some people get it, but I've experienced some people, and again, God love them. Like, someone once said to me, "Are you avoiding me?" And I just, I took a breath and said, "Babe, it's not about you. You don't understand. This is something I need to do. I know that you want to see me. I know that you want to. I'm still your friend, but right now I need to look after me." Yeah. Now, I was supposed to see a friend today that I haven't seen in probably the whole year, and I don't feel like, 100% today, like I've got pain in my arm. And so I know that I had to make a choice. I was doing an interview with you, and that's probably enough for my day now. I just got a new cat, so I'm going to be, playing daddy with the cat. And I probably just want to rest for the rest of the day. And so I said no. I said, look, right now, today, I'm not able. Can we reschedule? And I've got to be comfortable with that, because if I sort of just did it because I wanted to please my friend, then all that would happen would be that the condition would stay the same, because that's what I believe is the thread of the condition.
Yeah.
Is honouring the body, honouring self.
Absolutely, absolutely. And, a lot of people will say having this chronic disease has made me unreliable. And I think that's an honest assessment, because it's not predictable. Your energy is, and how you feel and how your body is not consistently predictable from day to day. And if you say, yes, I'm going to see somebody tomorrow, but the tomorrow comes and you just can't, are you going to make your friend more important and sacrifice your own health and energy? Or are you going to be honest and say, sorry, love, I can't do it today?
Yeah, I sort of see it where I agree with you, but I sort of believe now that I'm more reliable. Because what I've done, and I guess, okay, I had to get to this point to do this, is I've versed all my friends and said, look, just be mindful that I'm more reliable now on myself. And so if I can't make it to something, I'm going to choose to be reliable for me, but I'll let you know. So my friends know that may be the case, and they've been pretty amazing and supportive, but I'm now more reliable on me, where before I was unreliable on me. I would do so many things before where I was trying to please people, and that's been a big learning for me. Just, be reliable on you. What can you do? If you're honest and you can communicate to people, then, you can't control their reaction, but hopefully the people that love you and want to be in your life will understand. And, now that I've sort of got the group of people around me that I want, they're amazing. They're pretty amazing. They've all been able to step up and support me in a way that I need.
I love that reframe, Joe. That's absolutely fantastic. It's about being more reliable with me. And I think that's something everybody could take on board, because that's really what it's all about. And so to sort of we're getting near the end now. So to finish up, what advice would you give the partner and family of someone with a newly diagnosed chronic condition?
Okay. Well, I think firstly is patience, and just to be patient, to know that, I guess not everyone knows the cycles of grief, and so maybe have an awareness that there is such thing as a cycle. I went through really major aggressive, periods when I was on steroids, where I would just say things to my parents that I would never even say to a stranger. And then afterwards, I'd say, oh my God, like, where did that come from? And thank God we could laugh about it. But the thing is that, I guess, be present rather than thinking that you know what the person's going through. Or if you don't know, then be present and ask. Like, my mum and my dad have been amazing, but my mum's way to deal with things is, gorgeous thing that she is, always to be positive. And so I found that I had to sort of pull her aside and say to her, Mum, I'm human. I think it's normal for me to have a bad day. I need to get permission from you to back off with the sugar and cream and lollipops and rainbows. It's like there are going to be days where I don't want to get out of bed and days where I'm a bit upset, and that's okay. I'm managing that in a shorter time frame. And, just to allow the person to go through the emotional stages without, because I found myself at the beginning feeling guilty if I was feeling a bit down, and I put on my happy mask to please my mum. And again, that's not me being respectful to me. So I had to sort of sit her down. I was living with them, and I moved out into my own place just 3 months ago. And so now I've got to make her really conscious of not calling me 1,000 times a day. Not, trying to do it. If I have to sweep the floor, just to let me try and do it, because that's part of my recovery. So it's trusting and being there, but not trying to lead or control.
And I think that's really important, because there's this whole gamut of emotions that you go through. And, grief is not, you know, a start at this end and finish at this end process. You can go through the whole, you know, denial to anger to bargaining to acceptance to anger and, you know, all of that sort of stuff. And there's always going to be things that you'll run up against that are going to remind you and hit you in the face that you're not the person that you were before. Yeah. And rather than try and cheer people up all the time or push them into positivity, just allow them to feel what they're feeling.
Yeah. The other thing that I'll say as a humorous part of it is, as a partner or a loved one or a family member of someone that's got a disability, just be aware that there may be a tiny little bit of the person knowing that they're getting something out of it. You know, like I remember there was like a period where I was like, I felt like I was being served. Like, ring, ring, I want this and I want that. And I knew that I could probably get up and wobble to the kitchen and get a drink of water, but I didn't. I took advantage of their good nature, which I don't do now, but I have to giggle thinking that was a little fun little part window during the illness where, you know, I want ice cream or I want this, and it will just come like within a second. I'm thinking, this is good.
Joe Busuttil, were you using your vasculitis for evil instead of good?
only for like 2 weeks, but you know, well, you know, I guess if I'm really 100% honest, there probably are certain things that right now, 12 months later, that I am probably using as an excuse to get certain things. You know, like that's probably an important thing. It's just if you know, if you're really close to your loved one, then just to be aware that there are things that you're doing that are enabling them. You know, like some of the main things for me were like little things like just cooking or cleaning or whatever. I knew I got to a point where I could start doing certain things because my movement was better, but I didn't say anything. I continued to have my mum clean for me. And so I had to sort of step up and say, okay, you've got to stop this. You want to enable yourself to be sick or be the victim. You want to lead or connect with a healthy approach to life. So that means you've got to clean and you've got to cook for yourself, especially if you can, you know. So there are certain things I still can't do, which, you know, I get help for, but the things I can do, then I really need to be mindful of that and own that. Because I think that's part of the recovery rather than thinking I can't. So I guess a loved one's got to be aware of that, because I think there are signs when you can tell if someone can do something and they're pretending that they can't to get some sympathy or get something out of it. There's a payoff. Now, did you experience that?
Probably, I think, as somebody who's never really been ill, there is sort of something about being really sick that suddenly gets you a lot of attention.
Yeah.
And yeah, you can become aware of that. But yeah, I still had to do most things myself. Like even when I was really, really sick, I still had to cook for myself because I didn't have anybody really to help me. Like the boys did the best that they could, but you know, you just tend to take people for granted. But definitely I noticed I've had to mind my language, because for a while there I was really identifying, I was still stuck in the trauma of the sudden onset of the disease. And so I was, you know, found myself saying things like, yeah, 12 months ago I nearly died. 12 months ago I nearly died. And that just for me was like, hang on. You've really got to change your focus now. That was traumatic, but you can't keep feeding that all the time. So now I'm much more aware that I affirm, you know, I'm healthy, I'm well, had a great day today. So it's really made me more mindful of myself.
Yeah. And listen to, you know, I again, you know, not that I feel guilty, but it makes me realize that there are people that are worse off. I mean, like, I would not even imagine what it would have been like for me to be, say, non-supported and have to go through what I went through. Do you know what I mean? Like, to be, say, living in an apartment on my own and have no one, you know, to come and cook and all that sort of stuff. So I really look at, you know, people that have gone through situations like yourself where you've been ill and you've had to still look after the house. And I think to myself, how do they do that? And it just shows the resilience and the strength that we have sometimes to get through life when it throws us a curveball, you know. Yeah, it's interesting. Like, I will never ever take things for granted again. You know, I mean, I feel blessed that my relationship with my family has gone from, you know, a family to now, you know, it's really solid. You know, because, you know, they did step up and do those things. So it sort of makes you humble in a way to think, you know, I'm lucky. I'm lucky that I had my mum and dad there. I'm lucky that I've got people to come and cook for me or to help me.
And it can really highlight the things that you're grateful for. But then I think, God, don't you love it when two counsellors get together? But I think on the other side of that too, I see a lot of people who are in such denial that they have a chronic condition and who try and ignore it and who push themselves and push themselves and push themselves till they're going to get so dangerously ill. And I think there's that balance that you've got to respect the challenge that your body's going through, and you've really got to acknowledge the disease, but at the same time have that working relationship with it that's a positive one. And a lot of people go to either the extreme of becoming, you know, my illness consumes me and I'm the invalid, or I'm defined by my illness, or they just ignore it and try and push through. And you've got to find that middle ground.
And I guess that's the journey for some people, isn't it? Like, only like a month ago, the doctors wanted me to go on disability pension. And, I thought for a bit going, well, that'll be good. Like, I'll get money and I can just rest. But then I thought, no, hold on. I know that if I was to do that, then I couldn't work. And if I couldn't work, what would I do? I'd watch more television. And then before you know it, I'm in a position where I'm going to be defining myself as, ill. I know that at this point I could still go to work. I can still get up and do stuff. So I'm not going to define myself as that. But some people, I guess, don't have that awareness or that ability to see beyond, they may not believe that their mind can fix it or they can actually change their perception. So saying that we're counselors, I think we're lucky that we have that awareness. I think everyone's in it on their different journey, and people learn from different things, but you really don't know what's going on until you're in it. If you and I had this same conversation 2 years ago, both of us healthy, we probably would have had a different timeline of how we would have behaved and what we would have felt. Until you're in it, you have no idea how you're going to react.
That's absolutely right. Absolutely right. I have one of my cousins that I'm very close to. She has hypothyroid. So I knew that she had it. Like, she's been living with it for nearly 10 years now, and I knew that she had it, and I knew that it was very bad, and I knew that she nearly died because her heart rate was going so big, and she was losing so much weight, and she had radioactive iodine. I knew all this intellectually. And then when I got sick, I rang her up and I cried my eyes out because I felt so bad, because now I finally understood. I had all of this empathy, and I know we have on our forms, when we get our clients, and we have all the physical details, and I didn't really understand then the holistic whole body mind effect that an autoimmune disease can have on the way somebody thinks, the way somebody feels, the way their energy. So it's really broadened my work in that perspective, because it opens another world to you. And being chronically ill, you're suddenly in the world of the chronically ill, and that you didn't even know was there.
Yeah, totally.
With the whole different landscape of how people deal with it and what they do, and all the little groups and the factions and all of that sort of stuff. So in a lot of ways, it has opened my world up. In a way that is for the better.
If it didn't, that's the thing with the comparison with people that are in denial. Is the people that have got a chronic illness and they keep going and working and not being open about it, that's what's really happening, is that their world isn't being opened up. So when you're aware and you go through it and your world opens up, then you go for this amazing, ride in a way. A big thing that for me has been about perception from others, like not necessarily friends or family, but I'm talking about like strangers. Like, I did not know what to expect when someone saw me in a wheelchair. Like, it's interesting how, 70% of the people turn away. They don't look at you, and they don't look at you. Someone's pushing me, and 50% of them look at the person pushing me and ignore me in the chairs if I'm not even there. Well, then you have the compassionate people that connect with you and look at you in a way and treat you normal. So that was really big, and that sort of got me into my blog, just to talk about perception and, talk about things like, how does someone who's got a disability negotiate sex, or how does someone negotiate, being able to live on their own, or what do they need to do to get people to understand that they can, their minds are working. So you don't have to talk slowly. You don't have to treat me different. It's my body that's slow, not my mind. I had no idea what any of that meant until I was in it, because you're bombarded with it every day. The sorries was another one. Oh my God, I'm so sorry. No, don't be sorry for me. There's nothing wrong here. This is just what's happening in the moment. But it's sort of like they don't know what else to say, so they say sorry. And when you get bombarded with that, you sort of start thinking, oh my God, am I something wrong with me? It's just, so perception's a really big thing. The part of the world sees the disabled. And you said just before that, there's like another world. And in some way you sort of realise that world is hidden, isn't it?
Yes.
You go to the rehab and it's hidden away, and you go to these appointments and everything's hidden. You don't really see that world until you're in it. And when you're in it, then you see other disabled people and you hear their stories. And I wish there was a way that we could make it more mainstream and people can understand. I guess that's what this is about, and that's what the blogs are about, and things about getting awareness out there.
Absolutely. And I think one of the first things when I was researching about my condition to try and help myself was the internet can be a black hole, because there are so many people suffering in despair, in absolute fear and anguish and pain and suffering, and you can get drawn into that. And so I had to very consciously decide and be very focused on where I was going to look. But the opportunity is there for you and me and others to be like a beacon for other people who have got the same thing, to say, there is hope, there is change, even if the only thing you can do is change the way you see yourself. Then there is always something that you can do. And the more that people talk about it, the more that people realise, the more that people see that they can make, a massive change just by sharing their story, then that's profoundly powerful.
Yeah, I find that to be probably the most powerful, is being honest, because you're in some way releasing it from yourself, rather than having it brewing in your head. And the other thing is just the fact that it's about not saying no to things. I said earlier that I sometimes can be enabled to not do things, but I'm trying really hard now to say yes to catching up with people. Or, I went to the movies last Sunday and I haven't been all year, and I've been dreading going because of stairs and crowds and all that. But I thought I have to see Star Wars, so went to the movies and it was okay. I did it. So it's about telling yourself that just because the world is sometimes saying, oh, you can't do that, or you can't have sex, so you can't, go to work, but you can. It's being strong enough to sort of stand up and say, I'm doing this because I have to. Yeah.
And it's about refusing to let your world shrink, isn't it?
Yeah. I mean, of course you need to be honest and do what you really, don't overdo it, because I know that I could easily overdo it, but I'm just doing things that I love, making things happen that I love that aren't enabling me to sort of stay stuck. Because, if I'm stuck in the house by myself and I don't allow people in, then there's no one else to blame but myself if I feel isolated. So it's just pushing myself to sort of get through some of the mental and physical, signs, and just be present to the world. I'm still a human, still part of the world. Just because I'm sick doesn't mean I'm contagious or I need to be isolated. Yeah.
Well, it was so lovely to talk to you this morning, Joe. Thanks so much for doing it. And if people would like to know more about you or about your blog, or, how to work with you, how can they find you?
Yeah, so if they just go to my website, which is www.equator hypnotherapymelbourne.com. They'll get information about my clinic in St Kilda Road and Point Cook, and I do specialise in anxiety, and I'm doing a lot of stuff with trauma at the moment. And also there'll be information about my blog there, which is sort of designed to change the perception of disability. So yeah, so have a look at that, and hopefully people can connect, and we can start changing things.
Fantastic, Joe. Well, thanks again so much, and I hope everybody got so much value out of listening to everything you had to say, because I think it's really powerful and really important, and I look forward to catching up with you again soon.
Thank you. See you, Kerry.
Bye.